歡迎大家出席今日嘅
Welcome to the press briefing. With us today are Dr. Chang Shuk Kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Gladys Kwan, Chief Manager, Hospital Authority. They will brief us on the latest COVID-19 cases at the situation at DHA. Dr. Chang, please. Yesterday, we had a total of 2,085 locally acquired positive cases, including 771 confirmed through PCR tests and 1,314 verified RAT results. We had 183 imported cases, including 142 positive PCR results and 41 verified RAT results. Since the fifth wave started, the total number of cases is 1.24 million, 3,648 cases. We had no new fatalities today. I would hand over to the DHA. Good afternoon. 828 patients are staying in hospital, of which 132 are newly confirmed patients. Of the isolated patients, 312 are staying in isolation wards, 20 are staying in Tier 2 isolation beds, 284 patients are staying in the North Atlanta Hospital Hong Kong Infection Control Center, 104 were newly confirmed patients. Yesterday, 2 new patients were classified as in critical condition and 2 in serious condition. Altogether, there are 13 patients in critical or serious condition. 1 patient in critical condition is in intensive care. Over the past 24 hours, no COVID-19 patients passed away. Of the 183 imported cases, 141 tested positive through PCR and 41 through RATs. 106 were detected at the airport, including 61 who arrived in Hong Kong yesterday and 45 who arrived 2 days ago. 61 cases were detected at quarantine hotels. For the remaining 16, they were found after the arrivals left the hotel. Most of them had high CT values, and in some cases, the CT values were low, and they engage in certain activities in the community, so some of them could be local cases. We will carry out whole genome sequencing on these cases. For residential care homes, 3 residential care homes for the elderly and 4 homes for the disabled had 1 case each. For 3 of the residential care homes, 1 resident respectively tested positive. For 4 of the residential care homes, 4 staff members tested positive. Their close contacts would be quarantined. For schools, today there were 321 newly reported cases from 243 schools. 115 cases tested positive this morning. 206 tested positive yesterday or earlier. Of the 321 cases, 268 students and 52 staff members were involved. They came from 60 kindergartens, from childcare centers, 98 primary schools, 82 secondary schools, and 3 special schools. Over the past 7 days, 106 schools recorded 2 or more cases. And today, we recommended class suspension for some schools. The Catholic Salesian secondary school, 32 students tested positive. We recommend suspension of Class 5A for 1 week. For the Tung Wah group of hospitals, Chitwa Chang's kindergarten for Class N1, there were 15 students and 2 students tested positive or more than 10%. That is why we recommended suspension of this class for 1 week. Tuen Mun Government Primary School, Class 6A, had 20 students, 3 tested positive, and the class will suspend for 1 week. For Cheung Wang Wei Primary School, there were 26 students from Class 6D, 3 tested positive. Again, the class will be suspended for 1 week. The HK CTU Wong Chau Pio Secondary School for Class 5B, there were 18 students, and over the past 2 days, 4 students tested positive, and again, the class will be suspended for 1 week. Another was Yinghua College. In Class 3A, 5 students tested positive. There were 30 students total in that class. Class 2E, 5 out of 29 students tested positive. For Class 4C, 3 out of 21 tested positive. For Class 2D, 3 out of 27 tested positive. For some other classes, there were positive cases as well. So for these 4 cases, that is 3A, 2E, 4C, and 2D, there were a large number of cases. We recommended suspension for 1 week. We are conducting epidemiological investigations to look at the activities for these students. In terms of the subvariants, for the suspected BA.2.12.1 cases, there were 10 cases. 2 were related to prior cases. 8 were untraceable so far. For BA.5 and .5 suspected cases, there were 8 cases today. We had 1 new case related to hot foodie, and a family member of that case also tested positive. So altogether, there were 16 cases and 3 close contacts. For Class 4C of Ma Tau Chung Government Primary School, this class was unrelated to Class 6C. A student was suspected to have contracted BA.4.5. He last went to school on June the 30th. There were no other cases from his class, and we will monitor the situation. 3 cases were related to family members of prior cases that were BA.4.5. 3 cases are untraceable so far. One of these cases might be related to imported cases. The patient lived in Yunnan, Tai Keilang, and she performed cleaning work in cabin, and the test result on July the 3rd was positive. This was a suspected BA.4.5 case. We will investigate and see if there are related cases. None were detected so far. There were 2 other untraceable cases. One lived in Tanner Road, Yao Fuk Court. It was a suspected BA.4.5 case. 2 of the patient's family members tested positive as well. Another lived in Hai Tou Gui Manshan, Block 3. These were suspected BA.4 or .5 cases that were untraceable. Over the past 7 days, the daily local case load is about 2,000. The week before, it was about 1,000. So the number has doubled, and the caseload is rising in recent days. For BA.2.12.1 or BA.4.5, we have seen an increasing trend, even though they still only make up a small proportion of the total. But we saw that BA.4 and .5 variants are highly transmissible, and there is the risk of reinfection. So we must remain vigilant. We cannot let our guards down. Please maintain hand hygiene and keep your mask on. And if you experience any symptoms, please seek medical attention and get tested. That's all. Thank you.
過去一日呢，係
In the past day, there are 89 patients who have recovered, including 78 patients who have been discharged from hospital. Since the 5th wave, altogether, 52,305 patients have recovered, including 51,976 patients discharged from hospital. Since early 2020, in Hong Kong, there's been a total of 64,685 patients recovered, with 64,356 discharged from hospital. There are 4 who have been screened at hospital. being positive, and 6 of them had been deemed as close contacts. For XJ staff, as of today, there have been 24,547 confirmed with COVID, with 24,217 of them returning back to their workplace. So I have 3 announcements today. First of all, on the in Buddhist hospital, a 74-year-old male has been found positive, and there are 3 staff members who have consequently been positive as well. All of them are in stable condition, and now we are looking into the connection between these 4 people. We have suspended visiting hours, and we're going to continue to monitor the situation and continue to follow up with the CHP. This patient originally stayed in Tonghua Group Hospital, Wong Tai Sin Hospital, but because of renovation, this patient has been transferred over to the Buddhist hospital, and this patient has once again been transferred back to Wong Tai Sin Hospital to be isolated. And in Castle Peak Hospital, in the psychiatric ward, we will have another patient who is confirmed positive. And as of today, there have been 5 patients and 3 staff members confirmed. And in Nether Seoul Hospital, in the canteen, 4 staff members have been confirmed positive with COVID, and they're in stable condition. We're now following up on their cases. The catering services in hospital have not been affected, and the area has already been deeply cleansed and sterilized. We're going to continue to monitor the situation and follow up with the CHP on the latest updates. We now move on to Q&A session. Please identify your media or organization before you speak. The lady over here. Good afternoon, doctors from TVB. First of all, I heard that there is a large cluster in Yinghua College. Why are you suspending only particular classes? Should you suspend face-to-face teaching for the whole school? I also like to ask about hot pot foodie with one extra case today. There has been some technical problems with the ventilation in the kitchen and in the washrooms. Would you step up your monitoring of the restaurant to ensure that the ventilation would work up to par? Dr. Lo Chong Mao said he hopes that more people would be able to return to visit their relatives on the mainland next month. So how does the CHP assess the situation? Do you think there will be more outbreaks of BA.4 and BA.5? Do you think that we'll be able to open the borders without quarantine? We only heard from Yinghua College this morning. Currently, those 4 classes would need to suspend face-to-face teaching as with our usual protocol. We would need to check whether there has been any close contact between these classes with other classes, and we would decide whether there is a need for further suspension. Since these 4 classes have been suspended, we see other cases scattered around in different classes. So it's pretty similar with situation in other schools. As for the hot pot foodie case, I know there's been a mention of the ventilation by the relevant department. So it's around 7. It's above 7, which is actually higher than the basic requirement. I am sure that the relevant department will closely monitor the situation and to ensure that ventilation be on par with the air change per hour. Next question, please. The lady in the back. Good afternoon from Now TV. I would like to confirm the total number of cases in school, Dr. Chang said there are a total of 321 cases that include 286 students and 52 staff. So and the number doesn't tally. And we see many cases in Yinghua College. How many are confirmed cases? And do you know preliminary how they become affected? Did they engage in activities with their masks off? I'm sorry, it's 268 students and 53 working staffs, a total of 321. At Yinghua College, we are still conducting our investigation because of the large number of infections. We are going to try to understand the situation from the school. Next question, the lady in front. From Cable. I'd like to ask about the paracetamol medicine and medicine for the stomach for patients that are manufactured on the mainland. Why would you actually use these medicines manufactured on the mainland? And I'd like to ask about the situation of the 74-year-old male as well. Well, I know that no one has visited this elderly patient for a while, but we are still investigating how he became infected.
So, with more schools reported COVID infections, will CHP suggest schools to suspend all the classes instead of a particular class in the school later if a few classes in the school report cases? And with more than 2,000 local cases today, do you expect a continuous rise in the number of cases? Thank you.
I think the daily rapid tests among all the students and teachers has helped to prevent those confirmed cases into the, prevent them from entering the school. So even though some school classes, they have a few cases, they have not entered the school. So, but there may be some transmission among individual classes because of the high transmissibility of Omicron. So we will suggest to continue the present practice and suspend class suspension for individual classes.
下題，後面綠色。
Next question, please. From AM 730. For Yinghua College, other than those 4 particular classes, do you have a total number of infections that has occurred in recent days? And for the class 4C in Ma Tau Chong Government Primary School, it seems that they're not particularly close with class 6C. So what is the relation between that? And for the staff from ANNH, what are their jobs? Would they have direct contact with the patients? And would they be delivering food? So would you actually be able to deploy staff from other hospitals? I have another question for Dr. Chuang. Dr. Lo Chong Mao on his blog suggested inoculating children of under 3. Do you have more information on that? For the 4 classes in Yinghua College, a total of 16 people have been infected, and it tallies 23 students in recent days. The remaining 7 infected students come from 6 other classes. We are investigating the other students and looking at their seating and to see whether there is any relation of classes on the same floors. Preliminary investigation shows there's no connection between classes 4C and 6C, but because they are of the subvariant BA.4 and BA.5, it might be transmitted through other sources. Fortunately, we do not see many cases from other classes. The students will continue to conduct RAT, and I hope that would prevent outbreaks in the school. And I do not have information on your 2 other questions. For the staff from AHNH, they mainly work in preparing meals for the patients. They follow with the guidelines and they don appropriate protective equipment. There has been no impact on the catering services so far.
There were 2 cases from Class 2A. Next question, please. Good afternoon, this is Ming Pao. For the Ma Tau Chung Government Primary School, a subvariant was involved. So apart from the daily RATs for classes with positive cases, PCR tests have been recommended. Would the government consider this suggestion for the cluster involving hot pot foodie? How likely do you believe that transmission was caused by mechanical failure, that is the ventilation system, or was there transmission among the patrons? I'd like to know which residential care homes saw new cases. You said the daily caseload for local cases has doubled. Do you expect the caseload to double again in 2 or 3 weeks? The government hoped that the pandemic could be brought under control by August. So what is the CHP's assessment of such likelihood? For schools, we believe the daily RATs can effectively curb transmission, and we have seen positive results. RATs produce quick results. For PCR tests, they might prevent students from attending class. For the hot pot foodie cluster, there was some failure in some of the equipment of the restaurants, and different causes or factors could not be ruled out. There were people going in and out, and some people might have visited the toilet. These were all possible factors. For residential care homes, Ngan Tou Wu Lao Zhong Sim had 1 resident who tested positive. And yesterday, Dr. Kwan said these patients visited Caritas Medical Center, and we received new reports from the residential care home. And another was the Haven of Hope Care and Attention Home. A family member of a staff member tested positive, and that staff member did not report to work in recent days. In Wan Chui Wu Lao Zhong Sim, there was 1 positive case in a resident, and there was 1 positive case from a resident in a care home. For the Lun Se Fudou Wu Qing Shan Zhang, there was 1 case, and a residential home in care home in Shuichuan, there was 1 positive case for a staff member. We saw a gradually rising trend in the daily caseload, even though the speed of the climb was not as rapid compared with March, but still we saw the number double in 2 weeks. So if things do not change, we could see a further growth. Last question for the day. This is Hong Kong Economic Times. For the cases detected at Yinghua College, can you tell us about the distribution of the classes by floor? If the genome sequencing results of the cases tally, are you going to order a suspension for the whole school? What are the criteria for the suspected BA.4 and .5 cases? There were 8, but from our math, there should be 9. So this is something we want to clarify. Public hospitals now prescribing a new medicine or a stomach pain medicine from the mainland for suspected BA.4 and .5 cases. We identified 8 of them, and some of their family members also tested positive. So we might include those numbers. That's why our numbers might not tally. For Yinghua College, we are still investigating the situation. The 4 relevant classes will be suspended. We will investigate whether there are any connections or high-risk factors before deciding whether other classes will also be suspended. For the stomach drug you mentioned, I have no information on hand. This is the end of the press briefing. Thank you.